All right, 3:50. We'll start bringing everybody back in. Hi, Marie. I see your thumb. Um, Steve, do we have Maria Elena? There she is. Yay. All right. Okay, it looks like we have many of us back. Welcome back. I hope you had a nice break. It's such a beautiful day here right now. I went outside for a second and got some sunshine on my face. Okay, super excited about this next agenda item. Um, so the purpose of this time on public health modernization is twofold. First, we want to consider the approval of the refreshed modernization vision and roadmap that the Met Group has presented to us. Um, if we do not have a quorum, we won't be able to vote on this, but I think that we can still have a robust discussion and talk about next steps. But we may have to bring the vote back to next time. Um, and then second, to begin the discussion about what comes next, particularly the early implementation priorities. So as a reminder, FAB, our body serves as the overseeing and advisory body for this modernization work. We launched the vision refresh process last year with the hiring of the Metropolitan Group as a consultant to help us scope and move through this work. The process kicked off in September, beginning with the Conference of Local Health Officials retreat. And since then, Metropolitan Group has facilitated an iterative and collaborative process that's included multiple visioning and messaging workshops with core partners, including 2 sessions with us here at FAB. And the list of the vision and roadmap, or the list of partners and meetings is in the vision and roadmap document as an appendix. There are also a number of opportunities for partners to come together across groups, as well as a 2-week open comment period for final review and suggested edits. Um, After each engagement, input was incorporated and updated drafts were shared broadly so partners could see how their feedback shaped the document. And a confidential email was available throughout the process for anyone to send in additional input, feedback, or questions. So today brings us to the key milestone of voting on potentially and possible approval or not of the document as a basis for our work into the future on modernization. So with that, I will invite Maria Elena from the Metropolitan Group to provide a high-level overview of the refreshed vision and roadmap and address any questions.
Thank you,
Thank you for
Sarah.
joining us. Mhm.
Hi, everyone. Um, in case you didn't get a chance to fully digest the document, what I'll do is I'll just provide a really, really brief overview, um, just for navigation of it. So page 28 and 29, Sarah mentioned the process, the engagement process. And so that would be a refresher for you is to see the different groups that participated and when. And what I'll say is that at the end of every month, the groups that had had their session received an email with the latest iteration. And after each session, the work that was done in that group was also sent back to that specific group. And we did get feedback and input in the confidential email. Every single one of them was responded to. And often they were really smart questions that sort of made us think, oh, we need to further unpack this particular discussion point that came out or to clarify what was meant here. So we took that input really seriously. The same thing with the open comment. We got really great input and questions. And it wasn't so much, oh, you've gone in the wrong direction, but like you haven't explained this fully, or can you tell us more about this? So what you see here and what we've really tried to do, starting in the section with the vision on page 6, was to use people's words. What I will say is that, as you all know, because you've got representation from across the different partners, there were sometimes really different perspectives, and so we would have those discussions and try to unpack that together and get to something that sort of fit with what everybody was saying. Um, where we've landed is with as broad um, a document as possible that allows for real localization. The idea is people know their communities and they know their partners. And so even with the messages, we've tried to provide enough content to help people really understand what the intent was of that message, and then really stress add your local story, add your local examples, add your local issues. So I'll just stop there. You see the early implementation priorities. There was a lot of different opportunities that people raised up in the different conversations that we would capture. And then there's been prioritization happening, especially with Chloe and some of the local public health staff and OHA, and that appears on towards the end of the document, 20 in page 23. And so when Sarah talks about sort of what's coming next, we'll move into that after this discussion period. I want to open it up for questions. If if anyone has questions or comments.
Yeah, Maria Elena, I'm also happy to screen share the document if folks are interested in navigating to a particular place. Maria Elena has described the kind of background at the beginning. We have the shared vision statement, the vision in practice, which are those like tangible examples of what it looks like once we're able to implement the vision, value statements, key messages, and then immediate implementation opportunities and priorities. So a lot in there. And I appreciate you just describing again kind of the process that we went through and all the feedback that's been
That
incorporated
I
in.
will stress is that this, and we've talked about this in the different groups, right? Like you should consider this an organic document. Like you're gonna continue to learn and to develop. And so I assume that you're approving something that's sort of a foundational document that then continues to evolve. I shouldn't, that's my assumption. I should ask that question of everyone. But I think that's been the general feeling is that, yeah, this could be the foundation that we continue to build on. So I just wanted to mention that.
Appreciate it. So this is our time with you all. We sent this out a couple weeks in advance, so hopefully you had a chance to review. And we have Maria Elena here, who has been a part of every step of this process, facilitating conversations, responding to feedback, etc. And so, if you have specific feedback, recommendations, comments, we have Maria Elena here to be able to describe what's in the document and why, and then also we can talk through any additional feedback. I also want, maybe before we open up the floor to everyone, I also just want to acknowledge and thank Dr. Gonzalez for your review and feedback. I think everyone was on that email. Um, and you in particular, and wanted to note a recent addition that we haven't seen yet, but wanted to note that in your feedback, kind of the call for reference to liberatory, decolonial, and also indigenous frameworks to really be reflected in the document. I think we heard from partners in various kind of visioning workshops that were aiming for language that was pretty universal, can be applied in every area of the state. So are recommending that we don't include the specific language from the liberatory decolonial frameworks, but recognize the importance of the frameworks and thought for those in the state that can frame their work in this way, that it would be helpful to direct them to resources like the frameworks that you mentioned in your feedback. And so to reflect this, one of the kind of late-breaking additions that I know Maria Elena has added is a new item in that immediate implementation opportunities and priorities section of the document. that calls for compiling resources to support our next steps, especially around governance and decision making is one of the categories, community partnership and sharing power. And so noting a really important kind of immediate implementation opportunity to compile and elevate those kinds of frameworks and resources for folks who are able to frame the work in that
Steve,
way.
I can put, I just saw that Steve forwarded me your feedback, Dr. Gonzalez. So I just saw it like an hour ago. But I have some language here that at least we could look at. Is it okay if I just put it in the chat?
Well, I actually, if I could just jump in a second,
Please.
and I did I get your email just a couple of hours ago. So thank you. And for the response on the need to or the decision to use universal language. And I think I'm not sure that my critiques were well understood. What I'm trying to raise for us to consider is that the framing of, say, equity, which then everything else is rooted in and framed within, is defined from CDC and doesn't necessarily allow us to get to the deeper roots that create and maintain inequities. And so I was just sort of raising it up as something to challenge us to consider with intention, where do we stand in terms of that framing and our commitment to equity and the type of equity that we're going to follow. And so I did want to just say that it's more of a misalignment in framing, and some of the language that is identified and used in the roadmap suggests the liberatory decolonizing orientation, but it's not supported by the definitions that are used. So there's a misalignment. And the risk of that is that it could create a roadmap that presents itself as one thing through words, but in action is actually harmful or recreates sort of status quo. And so the use of universal language, my encouragement there is, what does universal orientation and language center on? What is the analysis or critique that it centers on? Does it reinforce unknowingly, centering on majority Western ideologies? We'll just say, sorry, I'm trying to be polite. But I just really want us to be very clear in the use of the language and the frameworks that we're proposing, because that's where harm happens and we're complicit to it. And it's where the trust with community is eroded even further, potentially. So that's just sort of high level what I was trying to get at. And then I tried to offer some solutions or some why this matters sort of framing. And it feels really important at this point in time, as we're putting in all of this energy, revising a roadmap that is going to guide us forward towards equity or not. And I can say from my sort of lived experience, this is not at all trying to uplift and center on indigeneity, but I can say that I didn't see myself in my experiences reflected in that roadmap. It did not speak to my experiences and how I experience or envision equity. And even with this caveat of respect, where communities can define health and wellness, that terminology of respect is it's difficult to take that seriously when the framework of equity is um, not rooted in like a liberatory decolonizing framework that really allows us to get at the roots of what causes and perpetuates inequities in the first place.
Yeah, I very much appreciate you just describing further your comments, or Dr. Gonzalez. Thank you. I yeah, I don't know if anyone has thoughts or comments response to Dr. Gonzalez. I saw a thumbs up from Marie. This is kind of our time to talk through these things. Yeah, Sarah.
I I really appreciate your comments, and I think back to, the work. There was work that was done on the health equity definition that FAB and was going to use, and I know that, each health department goes through a process of defining what health equity means in their for them. Like there are so many definitions out there, and I what I love about this roadmap being a living document and changeable goes back to some of the challenges we have in modernization right now. Like the modernization manual was made 10 years ago and has not changed, right? And I think that there is so much in all of this work that needs to be continually fluid and reevaluated, um, including our, agreed upon definition of health equity that happened 3 years ago. I mean, part of modern public health is to be responsive and to modernize. I think I I appreciate your comments, and it really makes me think about how embedding fluidity and change and updating of all of the things that we do in FAB, and for public health modernization in general is is something to build into that framework of how we do our work. Those are my thoughts.
I think it raises a bigger question that we were talking about earlier, Veronica and I as well, that we were presenting back to the group that our planning group has been, um, challenging around and thinking about is like, where do we as a group orient and situate ourselves in the equity work, and what are we standing by? And in terms of that definition. And then I guess one thing I would say is, like, as a barometer is, is our definition anti-racist? Does it align and support the anti-racism work that's been happening and the declarations that have been made by OHS or by OHU, OHA, sorry, I was going to say OHSU, OHA, and our regional partners and other entities across the state, and as well as like House Bill 4052 declaring racism a public health crisis. Like those are, I think, really clear cut um, uh, anchors and barometers that can give us guidance, that then it can encourage us further around, like, what are we centering, and what are we addressing? And just fundamentally, is it anti-racist or not? Because that's, I think, ultimately, like, I just hear so much about that, and I think this is an opportunity to honor that, I guess, unless we're not there anymore and I need to catch up. I don't know.
I mean, my and Maria Elena, again, I'm so happy you're here because you got to hear everyone across these workshops. And I don't think it's that we're not there. I think it's just acknowledging that some people are in places trying to do this work where that isn't like a viable frame or path forward all the time. And so I think I'm just going to pose again. That's why our recommendation is to keep the language at a level that is potentially more accessible for people across the state, but also work with you and others to identify the types of resources that you called out in your comments to include explicitly in some of our implementation next steps so that we can compile resources and frameworks and offer people ways to describe this work from kind of anti-racist or decolonial perspectives that are able to. Um, so I don't know. I think that was kind of the compromise that came to mind. But if you're saying like you don't want to compromise, I understand that as well, and we can keep talking about it.
I'm just gonna
I
say,
do want to just say one thing, like if I don't think it's like compromise. I think that like when I hear that there are entities not ready to do this work, then I know I know what that means for me on an individual personal level, and I also know what that means for people that experience the harms of oppression and racism, is that we're centering the comfort of those that benefit from not being, really rooted in having a strong analysis and commitment to anti-racism. So it's a lot to ask of us, right? Like, and I have a really hard time with that. I think on a values level, and then to know like, wait, is this group recognizing the worthiness of like my life and my safety? So that's kind of how I interpret that, and it doesn't seem like an acceptable choice. And maybe I'm bringing things up that are not appropriate in this group. I'm not quite sure. Again, I'm learning, and I'm not trying to be confrontational at all. I just really want to have some values alignment.
I wanted to point out that Marie has had her hand up, and then Marie.
I can wait. Okay, I'll go. Hi, Marie, she, her. I'm the statewide representative for the Conference of Local Health Officials. Um, I want to really lean in to the role of this group. FAB has led, has stepped ahead of individual counties' comfort and where they're at. This is a statewide group making recommendations to the state and up. And so I really honor, value, and resonate with the brave vulnerability of Dr. Gonzalez in this space, and really the call to action for this group on what is our choice that we're making knowingly to omit language, to sorry, my heart is racing. To lean into to avoid the discomfort of being leaders by doing something different than what some counties or some participants are able to do locally. This is a statewide group. We're sending a statewide message. And I really like us to think about how we elevate and incorporate the comments and the key questions that have been asked before we move to, I don't even know if we have quorum. I don't know if we're voting today, but it feels like we need to pause. And we really need to, if this group is the last group to review this, and we are the ones that are going to be putting forward a vote at some point, it should be reflective of where we're trying to be as a state, where OHA has already made commitments, where our state legislature has made commitments, and where, again, we're envisioning a future.
So I'm just going to give my perspective. First of all, Dr. Gonzalez, I think I really appreciate your um, your feedback and your vulnerability. And this is a really difficult conversation to have. And I just want to own that. Um, my personal fear is that unless you put action behind words, the lived experience is not going to match the written, right? So this isn't just about changing some definitions, which, right? This is also about then it's a much bigger conversation in my book. The conversation becomes, so how are we going to live up to this? Um, so that is my concern, is that words on a page become spin unless there's a whole bunch of action behind it. And there's huge implications because it's not just about this project. It's all of, if Fab is stepping up with this, with modernization, it's got to be across the board. It's got to be the work that's being done across OHA, across all agencies in order to have people actually have that lived experience. That's how I see it. Maria, you're off. Your sound is off.
Yeah, my sound is off. Taking off my statewide representative hat, just as a local public health administrator, I am not obligated, my agency is not obligated to align with this document. That is a choice that I will make as a leader to align with this document. This document is up to my understanding is it is a document that helps OHA, Public Health Division, and is a reference for us as local public health authorities where we can choose to align, we can choose to reference, we can choose to aspire towards this document. But it is not an edict, it is not a requirement. That is why I, as a local public health administrator, as well as a statewide representative of our conference of my colleagues, encourage us to have this document give us the language, the stretch goals, and really center in the values we want to see in this state. And we've already been moving in that direction because it sets a tone and it gives us something locally to say, we're not alone, we're aspiring to. It's not a direction down, but it is a tool that helps us locally to aspire to do better and to take action to do better.
Thank you for that clarification.
Also, I do just want to clarify, I did use the language of lived experience, but I do want to note, and thank you, Marie. I also want to say thank you. I do want to note that all of my comments raised, all the issues I raised and the solutions I offered were all connected to the peer-reviewed literature.
So I'll pause and see if other folks have any of the other FAB members have comments. But what I'm hearing so far, I think, is a proposal to, I mean, we're not voting anyway, but to pause and take some time to work more closely with Kelly on how we can incorporate more fully the comments and feedback, and then we would bring it back next time. That feels like the proposal I'm hearing, or some of the next steps I'm hearing. But I want to pause and see if there are any other folks who want to speak. And I'm sorry, I have a 8-week-old puppy, and I've been like pulling cords out of his mouth and doing all these things, and I hope it hasn't come across as disrespectful, like if my face is doing anything. So apologies.
Yeah, Steven, can you just clarify like what you're asking of me?
Um, yeah, I guess what I'm hearing so far from you and Marie, and I think Sarah, Sarah is appreciating all of the comments as well, um, that we go further in how much of your feedback we incorporate into the materials, into the vision and roadmap. And so in order to do that, we would kind of pause. We would have until our next meeting to be working with you and others on how to incorporate your feedback. You had a lot of great comments and questions, but I would need to be working with you to understand how exactly to incorporate some of the elements that you've brought up from the frameworks into the document. Um, so yeah,
Well, send it over. I'll change it to just how I want it.
um,
No, I say that jokingly, but like yeah. I mean maybe we can share my comments and my follow-up with the group. I think that would be important for transparency as well. And
Yeah, so I know the group was included on your message, but I think that's a great idea to resend. Oh, sorry, Marie. I just didn't
No,
see her.
it's okay. Yeah, thank you. I I didn't hear the pause to be one of let's pause so we can place burden on Dr. Gonzalez to do the work for us. I heard it as I intended for it to be a pause for us as FAB to set an intention and take action to look at the feedback. We all received it. We need to look at it as a group. We need to find ways as a group to incorporate it. I I kind of feel that yeah, this is not it's not appropriate to put burden on an individual. We are all responsible for actively engaging in this, and if it's you we as a group, we ask OHA, as this group asks OHA to bring that to back up to the top of our emails, to ask us again as a group to set a deadline, to give us like there's an action for the group. I'm not comfortable asking one person, especially the person that's already shared the information with us, to carry that burden. We all have a responsibility to understand it, to incorporate it, and to make proposals. That's my perspective.
Yeah, I appreciate that, Marie. I wasn't intending to place the entire burden of the work on Dr. Gonzalez. It was more out of wanting to understand how it could be incorporated into the document. I don't want to make any assumptions and not really reflect the intention of Dr. Gonzalez, but I hear you. And so maybe in addition to the follow-up items that you just said of resending the comments out so everyone has them. Could we, I don't know, it's like take volunteers for a work group or working with you and Dr. Gonzalez on a first pass to get draft language that then everyone can review. I guess I'm just trying to understand how we get to that place where we have some revisions for people to be able to dig into. Or starting earlier with everyone if a work group could be formed to review the comments and then meet and talk through revisions.
I wonder if I should defer to our chair because there have been just a few voices and we don't have quorum. So there are others that are not here today that may want to weigh in. I don't know if this is a consensus vote conversation on whether or not we want to do something. I'm deferring to our chair and OHA staff because there may not be an interest from the majority of the group. You've heard two members of the group.
We don't have quorum, but there are lots of others. Does anybody else have thoughts on um, I mean, I think we definitely need more discussion and ensure we have shared alignment. I don't know the best to do that when we have such a small group today, um, because there are lots of others that we need to get input from. So I don't, and I think we are also limited by public meeting rules as far as what we can do sort of through email. Um, I am curious from others what your thoughts are. And Sarah, you have your hand up.
Yeah, I think, hi everyone, it's nice to see you. I I think we can all take a little bit of a breath, perhaps. We know that we will talk about this at a future meeting and that we're not trying to resolve it today. And um there is no absolute deadline by which this is needed. I think it's important and we want to move it forward, but I think we can all realize that we have a little bit of space in here. Um, if it feels like it would be good for this to be a group conversation, then we can see about, making sure that we have a good amount of time at your March meeting to have some of that conversation. I think we would really ask members to, review all of the materials. I think it's a little hard when people are coming in not being familiar with where different things are coming from. But we can have the time. Hopefully, we can have the time to learn more about the frameworks that are being discussed and really put it into the context of what was presented today. So that would be another option if it's, if it feels valuable for this to be a FAB conversation. I think we can help do that.
Yeah, I'm thinking back to other sort of work group versus full fab work, and a lot of it we tried both ways with the charter and bylaw review. I think, making, wordsmithing documents is always easier in a smaller group, but does really need the input of everybody on this board. So both worked. I think having the conversation about like what you were saying, Marie, is this our shared goal? And then wordsmithing, which also has to be done together. I don't know what I'm thinking. I'm just thinking out loud. But yes, lots of time on the March meeting. That's good. Anyone else have thoughts? I think it's also a tough conversation that sometimes is easier with smaller groups to have everybody feel comfortable expressing their concerns and questions. Um, so what I'm hearing is next steps is we try to Mm. I'd like to encourage other FAB members who weren't here to be able to watch the video, or get notes out sooner than a week before next meeting. If this is what we want to spend next meeting time on, I'd like to make sure to give everybody more time to prepare for that conversation. Is that something that we can do?
We can, and we can package everything because it's hard when things come in different emails.
Yeah. Nick says for the full FAB to participate about what language to include or not, it'd be helpful to have all proposed drafts for consideration. I don't think I've seen variants on what was shared. Good point. Thank you, Nick. Hey, Dr. Pettyway. Thanks for joining us. I don't know if anybody can give an overview to Dr. Pettaway of what we've been talking about for the last 10 minutes. Be helpful. I don't think I can very well.
I'm happy, but I'd love for someone else. Y'all are so quiet. So yes, Dr. Petaway, I've been taking up a lot of space. People have been very gracious and patient. So I provided some feedback on the framing of the roadmap, the modernization roadmap that we were received and invited to give comment or feedback on. And the intention was to have, I think, a vote of whether or not we approved it today, but we don't have a quorum. And also I brought up some concerns and issues that I wanted our group to consider before moving forward with, deciding of a full endorsement or not. And I sent an email to, I think, to the entire FAB body to outline some of those main concerns that I had. And then I just sent a follow-up response to a couple OHA staff. And in general, I see some misalignment in the document. And I think it stems on the definition that's being used for equity and then sort of subsequent sections in the document that suggest, so the equity definition is rooted, comes from CDC. But then there's language and suggestion in other parts of the roadmap that suggests more of a liberatory, anti-racist, decolonial orientation. And there's a fundamental misalignment, and then also just other uses of language, that I've outlined in my issues and concerns, and then offered solutions and peer-reviewed research papers to support my comments and my issues. And the response the high level response that came back to me was this desire to use sort of universal framing and language in the roadmap itself that was shared, I guess, across groups that were involved in giving feedback and input on the roadmap, the content of the roadmap itself and the framing of that itself. So I made comment about that as well. So really just offering us an invitation and opportunity to consider some of the framing that we want to root in this roadmap, and to identify and maybe clean up some misalignments that could be problematic in the future, I think.
Thank you for that overview. And I want to add that Maria Bowman Davis had a lot of comments as well, and then had to leave early for another meeting. But one of the things that she noted is that this document is an opportunity as a sort of state board advising OHA to be very bold in our vision, and that local public health authorities, it's not a mandate to follow this, right? It's really a visioning that everybody can use in ways that work for them. Um, so I'd love to open it and see if you have any comments or questions, but I also want to ask after that, I feel like the framing, we clearly need to have some more conversations on the language and the framing and the true vision. I think there are a lot of next steps and tangible work plan suggestions that are still valid. And we could, you know, make uh, some goals for having the framework more aligned and still move forward with some of the planning of how to go about the communications of it. Is that a fair thought? Kind of some of the priority next steps. I think we could still have a conversation about how we move forward with this um, with the roadmap options.
Just so I'm
Okay.
clear,
Thank you, Ryan.
there's no quorum for approving the roadmap as it is right now? Is that
That's correct. Yeah.
Oh, okay. And I guess a further clarification question, are we just going to wait till we have quorum and then approve it, or are we going to take the feedback and decide that this is short of expectations and not in alignment with literature, theory, evidence? So what's the just so that I'm clear, based on what Kelly just shared and the work that she put into those comments, I also have some thoughts and reflections on those things. I just want to make sure that we're not just waiting for people to come on and say, I second. Is there another process? Is it just between us on the board to make those edits, or is it back to the Metro group for another session? I'm just kind of, I'd like to get some clarity on that.
We've had a few different conversations about how to move forward. I think that spending a fair amount of time on our March meeting as a group of FAB to get closer to something that everybody is in alignment with a goal of having information from this conversation readily accessible to FAB members who weren't here, so that we can all be thinking about it more. Sarah or Steve, do you have other thoughts?
No, I don't. I think it sounds great to be able to use the majority of March to continue the discussion. I think what I am not understanding is folks' preference for kind of pre-work, for like convening a group of folks to sit with and talk through Dr. Gonzalez's feedback and offer up some potential language for people to review and talk through in March, or if we really just want to use March as like a working group, like a workshop time and dig into it all together in that space. So I'd love to
Yeah,
hear more
I
about
don't,
what folks would prefer. Oh, sorry, Sarah.
no, that's okay. I'm cutting you off. I don't think we all have I don't think that's quite defined yet. Um, but Ryan, if you have do you have other sort of thoughts on that you want to share as we all ponder through the input that we've received and keep rolling with it?
Um, yeah, I think that I didn't get to spend a lot of time with what Dr. Gonzalez shared, but it's robust, and what I did read from it seems pretty consistent with some of the things that we actually discussed at I think it was the last group the big thing we had at Kiln with the folks, and it didn't seem like things were fully incorporated in there. So I'm kind of running with that process. But I do think that there are the few things that stood out to me and just looking at it, it again comes back to language and signifiers and whether we understand what we're saying, and whether we understand that it's important to have linguistic coherence across the different levels. One of the things that I point out very early on is this phrase around achieving health equity. That's not a thing. It's just flat out not. It's a constant struggle. It's a conflict. It's a political battle. And so I understand that it's supposed to be aspirational, but I think we're not doing ourselves any favors by making it sound like we're going to do this thing and we're going to be done with it. We're just not going to be. I think it's better to just commit to the fact that we're going to have to constantly be moving and fighting and in this tension, right? And organize ourselves accordingly. And that requires a shift in our language. And I think that aligns more with what Dr. Gonzalez pointed out regarding taking the anti-racist and decolonial anti-oppression lens. The reason we say those things because we mean those things, because that means that there is oppression, that means there is settler colonial logics, and that means there is racism. And if we're not reflecting that in the things that we want for us, then we're not actually moving in the right direction. We're just accepting and not rocking the boat. We're status quo protection, right? It's neutrality, basically. I read the entire document as being very neutral, trying to be like all of us together. And we realize, so I think that I'm an academic and a former practitioner. We must realize that we're not technically, or we're not practically all in this together. There are folks that don't want others to have the things that they have. We're not doing ourselves any favors by just not calling it out and planning to do what we plan to do and want to do for health equity, regardless. Um, so it's a different orientation that requires a bit more just being explicit about that and radical imagination. It seems very it's using the language of like the trendy, buzzy things that people will support because they are not too they're not too uncomfortable, right? It's like the safe approach. And so I don't know. That's the core of my concerns. I have specific concerns about each section regarding vision and workforce and equity and those things, but I think that the overall thing is that we're not specific enough, and I just feel like we're just being broad, and maybe it's in response to like all the executive orders, the funding things, the anti-DEI, PEI things, which by the way are kind of stalled and dead in the courts. And so if we are serious about this, I just feel like we need to just say it with our chest and stop tiptoeing around it. And right now, I feel like this is a tiptoe document. There's some core things in there. The feel is there, but the language is allowing a lot of room for folks not to do the actual work. So hope that helped a little bit, but otherwise, I don't know.
Yes, I think that's helpful. Thank you. Um, so much on services. So, of those who are here, um, let's just do sort of a thumbs up, thumbs down kind of. Is anybody interested in doing so we are, on this board, we are set by public meeting rules. So it's really difficult to do interim work as a board through email. That being said, does anybody want to be on a work group to work on this before next month? Do people agree that we can try to get out some info for all FAB to think about and present the issues, or really watch the recording, I think would be probably the most helpful thing, and come prepared to have a work group as a full FAB next month? Or was that not clear? That was probably not a clear statement. Steve, can you help me?
Yeah. So I think option one is the work group, and I didn't see anyone raise their hands. And then option two would be to get resend Kelly's comments, send the recording so folks who weren't here can listen to the conversation that we just had. And then I think we would all come prepared to kind of work through the comments and discuss any suggested revisions like in the March meeting. So it'd be kind of a workshop. And yeah, so is that sounding better than a work group? I can't tell what people want.
I can't either. A lot of straight faces.
I think we're tired or something.
Well, I do want to say that I think there is a lot of really good work in this document. Marilyn, I want to thank you for um, um, I know that you've had multiple meetings with multiple partners, and I do see iterative changes that have incorporated feedback. There may be more feedback that needs to be, I mean, there clearly is more that needs to be adjusted, but in general, I think there is a lot of um, sort of, I think there's a lot in this document that is that just shows your great work and your great synthesis of what you've heard from hundreds, if not thousands, of different people about this topic. Um, do Steve, do you feel like so we know March, we may not get to something after March, but there still are implementation priorities. Do you feel like there's still a conversation to have around that, making a hopeful assumption that we can come to some agreement on the framing in the next couple of months?
Yeah, I'm sorry. Right. Starting to talk through the implementation opportunities now, or like what we can address that next time as well.
Well, we have plenty of time still tonight. I'm wondering if you think that there's any implementation priority conversation that we can have at this point.
Yeah, I mean, yeah, if folks feel okay with kind of um understanding, yeah, kind of setting aside and understanding our next steps to really go deeper on Kelly's comments and talk through that in either a work group or the full group in our March meeting. That sounds great to transition toward the end of the document with some of the implementation opportunities and start to just get your initial thoughts and feedback on those. Because not often. Sorry, I want to make sure I'm reading comments. Seems like a
And
lot.
I also, as we're getting there, I feel like the work plan work group had some similar kind of priorities that came out that are kind of did the work planning work group have this document to work on, or we just um, we can look for the natural alignment that was made there.
Yeah, that's a really good question. So if folks want to transition to that, I can share my screen and walk through that. And Veronica and I kind of came to the same realization that there feels like a lot of overlap between the opportunities that came up through the visioning sessions and the work that the work plan group has done to date. And so we were thinking, once we're able to get folks' thoughts on those opportunities and the priorities, that it might make sense to, where appropriate, just combine into Fab's work plan. So we're not having these two kind of parallel efforts. But um, yeah, do you are we feeling okay? I cannot read the room. Are we feeling okay? Like hop into implementation opportunities?
I'd actually love to know where people are, like, what's going on for you all. Is there
Yeah.
just indifference? Is there like we're all trying to figure that out, and I see some comments, but I would just love some input of, is this way out of left field? Is there indifference? Is this of interest? Just because my concern is that if we come back in March, like it's not really clear to me how we navigate this and beyond a few voices. And then also to be respectful of folks who maybe don't agree with this, what I'm bringing up, what Dr. Pettaway is bringing up, and but don't want to disclose that because, for whatever reason. So I want to be mindful and safe around that as well.
Thank you, Dr. Gonzalez. I appreciate you calling folks in.
Okay, we can go around the room and then just popcorn to the next person. And Veronica, let's start with you.
I'm not a FAB member, so I don't know if I would like to hear from our fellow FAB members.
I mean, I was sort of joking in a way, So I don't want to put anyone on the spot.
Yeah.
But,
I just put
yeah.
I just put our group agreements in the chat just so that we can see. And
Oh, good.
I do want
Yeah.
to say we have not, as this current iteration of Fab sort of re-agreed to our group agreements. That's something that we've talked about is how often do these things need to be revisited, similar to how often does our charter and bylaws need to be revisited. But experiencing discomfort and accepting and expecting and accepting non-closure are, these are parts of this is tough. This is tough, tough work. And I think that my sense is that there are a lot of people having a lot of thoughts that may not want to share, and that's okay. I think I think there's um um I would love to hear from more people, and I would love to have more Fab members here, and like going around would be good, but I also don't want to put people on the spot if they don't feel comfortable.
Yeah,
So
absolutely. Absolutely.
yeah, I mean, I think that for me, I have heard you in particular, at the retreat and have some conversations and sort of it's hard to figure out how to put it in language in a process like this without sort of seeing some of the drafts, right? And seeing this draft and hearing your responses is really helping me understand better the kind of the root of the challenges. I personally think I need a little bit more time to digest that and understand what's gonna work for our LPHAs who are, you know, there's a lot of work that we do that we are careful with our leadership around the language we use in very we all have to be careful about language in a lot of different ways, right? And there's some things where um like a number of us around, climate work, which is clearly work of um, issues affecting health, and people cannot use the word climate in their communities and actually still get the work done. There's just some like and what I hear is that that's a role of Fab to be a leader and saying that that's not okay, that we need to use the right language. But how to incorporate this document and how this document needs to be used by everybody, that it is by every audience that has put input into it, it's just tough. So all I can say is my feedback is that this is tough, and I thank you, and I'm still digesting. I think seeing other drafts like is what Diana and I think Nick have mentioned of like if this word isn't right, what is the right way of doing that? And I think that's stuff that we can potentially um, keep working on in March.
I do think working from active drafts would be useful. I think some of it is language specific phrases and words and usages, but I think that the bulk of the document is solid. Like like the body of the text, if you just take it for like a word for word thing, like 90% of the document it's working well. But there are some points in which language allows a bunch of hand waving and gaslighting to happen. And so it renders the rest of the document as, for me, when I read it, disconnected, uh, impracticable, um, disingenuous, right? Like it doesn't feel like it's doing what the work that it needs to do. And so for me, it'd be helpful to understand whether that's because of perceived external pressures and limitations, or like we don't want to say the part that we really mean out loud because we want to be more low key with the thing, or is it because we don't realize that there's a meaningful difference here in how we take up space with language and how language is a form of power. And I think if we're ceding our power in the document, then what does that mean? And also, it's OHA, and so I'm not sure the extent to which county jurisdictions and county codes. Again, this is why I think legal epi is so important here. I'm assuming that there's levels of preemption here. If the state says the state's doing this, then everybody else has to get on board. And if the state's not taking leadership and setting the floor level for what's expected for the counties, then I just don't know what the vision of equity could possibly be if you allow so much variation across county jurisdictions. It's practically I don't see the logic in it. And so I think that that's why it's important to tighten up some of these really core themes with the language. So that the rest of the document that is solid, like ushers in us a path forward.
Now me.
Yeah, go ahead.
I think we're getting to next steps, Sarah, with everyone accepting that we probably need some drafts for people to share their input. I'm going to share that even for me, some of the language is new to me, and I'm assuming that why we're having a lot of like silence today is it's new language for potentially other members as well. And it's hard to have an opinion on something you don't understand, right? And so I think it's fair that we have drafts and time to look at that, or members have drafts and time to look at that and come back. Also, since OHA has been mentioned, we OHA were really trying to move away from being directive, like this is what we lead and you all should follow. And a lot of work has been done to create space to have the partners across the state help to develop what we're going to, how we're going to move, how we're going to do the work across the state. And that has worked really well in the past, at least the past few years that I've been in the government public health system, where there's been input from LPHAs, other parts from tribes, from other parts of governmental public health system, and additionally creating space for non-governmental public health partners to also help inform that. I think it's great that we have everyone here to provide, and we're providing this space. I do see the potential of like a standstill of, we're all coming from different spaces and it's hard to all then agree on one thing. I know that's always challenging, but I think I want to appreciate the fact that we've created space to hear things that we don't typically hear as we work towards where we want to go. I just want to name that.
All right. So clearly we're gonna revisit this in March. And are we've already talked about sending the recording, resending Dr. Gonzalez's comments. We've had other like great comments from today as well that people can see in the recording and the notes. And are we just kind of jumping in comment by comment in the March meeting and trying to do sense making like in the meeting itself around these frameworks are that people potentially are just first being introduced to, and talking about that together and then talking through what revisions they might imply. I'll just say that sounds probably really useful, but also like difficult to do in a meeting altogether. And so again, I'm wondering if that's the approach, and just, well, as Sarah said, we can take our time and maybe it'll go over a couple meetings if we're going to do it all together? Or again, do we want kind of a work group to do some of that work and provide some just suggested language revisions? Like if we incorporate these frameworks more explicitly, if we have the language more coherent, like Ryan is, or Dr. Petaway is saying, here's what it would look like. So people actually have language to react to. Um, I guess I'm sorry to keep bringing this up, but like what approach makes sense for the group, or am I pushing on something that I don't need to?
No, I think it's fair. I think I'm struggling with this too. The planning work group that already exists, is that sunsetted or is that still going on? And can we potentially ask the planning work group to address this a little bit? Yeah.
It's still going on. We don't have a regular cadence.
Mhm.
And we have 3 people at a time, so we have not had a full work group. So I think we might just have the issue again of
Okay.
making sure that the people who want to provide feedback or a time that works for people.
I think that would be my proposal, is see if that planning work group can reconvene and address how we plan to work to, yeah, to do this. Stephen's nodding.
Yeah, is that okay with you, Veronica, as the person convening that group?
Sure, yeah.
If there are any members that are here today, like, does that sound okay? If that
I
member,
can send an email following up with all of this information that we talked about, who wants to be a part of it, and then we can schedule that with enough time to before the next FAB meeting.
okay. Okay, that sounds great. Thank you. Thanks for that suggestion, Sarah. And thanks again, Dr. Gonzalez in particular for like elevating this. Thank you. And I know we had like 8 minutes left in this agenda item. Do we want to? I feel weird about hopping to the bottom of the document and starting a conversation about implementation opportunities at this point. So I think I'd recommend that we save that for next meeting, but up to you all if you want to start.
I do just want to say thank you. That was that was a big step for me, and I really appreciate the space and the encouragement and um, and the opportunity to give my input and for it to be considered. So I just want to say thank you to all of you.
Thank you. I definitely appreciate your input and I appreciate you. And I appreciate that jumping into the bottom of the document when we don't have an approved document is probably not the right thing. So uh, let's see. I'm seeing on our needs for upcoming meetings. Let's see. Um, is the metrics and scoring committee presentation in March as well, Veronica?
It's a future. I'm not sure if it's March or April yet, but we'll have confirmation by next week.
Okay. I think there's still probably time for both.
Yes.
Okay. And then the incentive and funding work group. Steve got a couple of potential interests to follow up on, right? Okay. I think that's we need for sort of short-term agenda planning. the accountability metrics report, when is that ready for updates to FAB? April, May?
That can definitely be April or May.
Perfect. Okay. I'm gonna just open it up for a minute for any sort of final thoughts from anybody, Marilena or anyone on to kind of round out this topic, and we'll move forward with asking the planning work group to come up with some more drafts and talk about it more in March. We'll open it up for more comments, and then we can move over to public comment in a couple minutes if there are none. We started out running about 15 minutes ahead. I'm a fan of continuing to be 15 minutes ahead and end early whenever we can. Veronica, would you like to facilitate public comment?
Sure. We didn't receive any written comments, so if we have anyone in this meeting, feel free to unmute yourself or share in the chat. Okay. No public comment. Back to you, Sarah.
Any other thoughts, questions, comments for the good of the order, and then we can end early? I just want to reiterate my appreciation for all of you who are here today and for being part of this really, really tough work and important work. So thanks for being part of our Oregon public health system and being here. I appreciate it. We can go ahead and adjourn.